You're watching ACC Update on CardioSource Video News.
Coming up, CMS has released the 2011 Medicare Physician Fee Schedule. We'll look at what this means to CV practices. And we'll look at partnerships, programs, and tools that the college is developing around patient-centered care. And later in this program, ACC's Senior Vice President of Professional Development and Education, Dr. Joe Green, will join us to talk about ACC's educational programs and initiatives.
From the American College of Cardiology in Washington, D.C., this is ACC Update.
Welcome to this edition of the ACC Update for December. I'm Lisa Fletcher. Our top story: the Centers for Medicare and Medicaid Services has released its final 2011 Medicare Physician Fee Schedule. The rule includes both payment and payment policy provisions for all physician services. Overall, the rule does not include any egregious policy proposals on the scale of those included in the 2010 rule. That being said, cardiovascular professionals will continue to feel the downstream impacts of policies that were finalized in 2010. Some other provisions of importance to cardiology include payment changes for diagnostic cardiac catheterization and lower extremity revascularization services, a decision to revise and rebase the Medicare Economic Index, a formula adjustment that impacts all services, and more details on participation in the 2011 Physician Quality Reporting Initiative and e-prescribing program. A comprehensive overview is posted on cardiosource.org. The ACC's NCDR this month is launching its newest registry, the IMPACT Registry. IMPACT will track prevalence, demographics, management, and outcomes of pediatric and adult patients with congenital heart disease who are undergoing diagnostic catheterizations and catheter-based interventions. The ultimate goal? To increase the scientific knowledge base for congenital heart disease and support the development of evidence-based guidelines.
We're so happy that the FDA has decided to form an alliance with the American College of Cardiology in supporting IMPACT. Through contracts, we have received critical funding to make sure that the data elements that we have created for IMPACT will support the type of work that the FDA is doing.
For more information and to enroll in the registry, visit ncdr.com/impact. At its core, patient-centered care is based on empowering patients to become active participants in their own health. To succeed, it requires patients to first understand their disease and second, be able to self-monitor their condition. It is through this lens that the American College of Cardiology has been focused on developing partnerships, programs, and tools to make patient-centered care a reality.
I'm particularly proud of how we're using our National Cardiovascular Data Registry and our risk adjustment models in making patient-centered informed consent forms so patients and families truly understand their risks related to revascularization.
Approximately 1/3 of adults lack the level of health literacy to allow them to plan and follow through on recommended diagnostic testing, medical treatments, and maintenance of preventative health. The ACC is working to reverse this trend through its nationwide CardioSmart initiative to improve heart health.
Some of the recent CardioSmart initiatives have been a hypertension pilot in California, which involves patient self-management. Also the health fair, both at ACC 2010 in Atlanta and another one coming up in New Orleans. And also we're organizing a walking program where member physicians and nurses walk with their patients.
For more information, visit cardioSmart.org. When we return, we'll be joined by Dr. Joe Green, ACC's Senior Vice President of Professional Development and Education, to learn more about ACC's educational programs and initiatives. Stay with us.
It's time to renew your commitment to quality care. The deadline for payment of ACC members' annual dues is December 10th, 2010. Pay today at www.cardiosource.org/dues or by calling the ACC Resource Center. The Jack iPad Edition, free to all ACC members and print journal subscribers. Navigate journal articles and related video, audio, slides, and commentary with a touch of a finger. The Jack iPad Edition. Everything you've come to expect from Jack and more.
Welcome back. I'm pleased to be joined by Dr. Joe Green, ACC's Senior Vice President of Professional Development and Education. Dr. Green, thanks for being here.
Thank you.
Listen, talk a little bit about how medical education has changed over the past few years.
Well, historically, what physicians have faced is that they had a requirement for 50 hours of Category 1 credit every year for 3 years, or 150 hours, which doesn't sound like a lot. But that 150 hours could be in any subject matter, didn't have to even be related to their practice. Now, of course, everyone's looking at their competence and performance and requiring maintenance of certification, maintenance of licensure, all related to exactly what they're doing in the performance around that to improve patient care.
And how exactly is that improving patient care?
Well, when they're actually looking at what they do in practice, then the physicians are required to then implement something to improve that and then go back and look at that practice later on. So there's a reinforcing aspect of it. It's a continuous quality improvement process, which we've needed for years, and now it's being required in all the maintenance of certification and maintenance of licensure that's developed.
So what have been the biggest hurdles in implementing these changes?
Well, I think, first of all, physicians have been very, very independent. And very few people were actually looking at their performance, and if they did, they didn't have the ability to judge that. Now everyone's looking at it, and their reimbursement for the care that they provide is based upon the quality of their performance in treating patients. So that's been the biggest hurdle, is to get physicians to understand that this is an inevitable thing that's coming with all the changes in healthcare reform and the rest of it. They're going to have their performance looked at. So now they're getting far more involved in some of the activities that we're providing in education.
And speaking of that, what is ACC doing to help cardiovascular professionals in light of all these changes?
Well, we're trying to do a number of things that make it so that the requirements that they have in maintenance and certification can be taken care of in multiple ways, and hopefully a lot of them at times when they're actually in their practice rather than having to fly away to the Hart House in Washington, D.C. to take an educational activity or take a self-assessment exam. But we're providing self-assessment exams to prepare them for their maintenance and certification exam or their recertification exam. We're providing a number of other educational activities that qualify for Part 2 MOC or Part 4 MOC. And we're also providing some additional tools that they can use to search our critical documents, our guidelines, et cetera, that are on CardioSource. We're going to now provide them with an ability to actually go in and find answers to their patient care problems as they're getting ready to go see the patient.
Any big educational changes on the horizon?
Well, I think there's just going to be more of what we're seeing now. There's going to be more accountability. And so all the educational activities that they got before where they just got credit, now they're getting credit, but they're also getting MOC Part 2 and Part 4 credit, which allows them to be recertified. So I think that the stakes have increased significantly. So we're just trying to provide as many activities as we can that allow them to do this in a non-threatening and in an environment where they can continue to learn and improve their practice.
Last question. What, if anything, should cardiovascular professionals be doing right now to prepare for things coming up in the near future?
Well, I think trying to understand what the maintenance and certification requirements are is probably the first step. Most physicians who are not facing it this year, and it's been a 10-year process, have waited until year 9.5 to see what the requirements are. And so we're encouraging them to look at it so that they can start planning and take some action over the long run and not have to do it all in the last 6 months.
All right. Dr. Joe Green, thanks for being with us.
Thank you very much.
Join us next month for all the latest news and information from your college. I'm Lisa Fletcher. Thanks for joining us.